Well, lung cancer is the #1 cause of cancer deaths, and even when it's found, it can be extremely hard to reach. But new cutting-edge technology is here to potentially save lives.
Yeah, and one local woman was able to catch the cancer in her lung before it was too late. Wink News health and medical reporter Amy Osher has her life-changing story.
I beat the odds.
A scan for kidney stones showed a spot on one of Tony Lee's lungs. A subsequent screening didn't pinpoint cancer. A biopsy would remove all doubt. The traditional procedure was a bit of a hunting expedition through the far reaches of the lungs, the way doctors described it to Tony.
We may puncture the lung because it's in the lower left lung lobe, which is a really difficult area to reach. So it sounded so daunting.
But Lee Health pulmonologist Shyam Kapadia had a different approach in mind.
Historically, what we would have done with Tony is made sure that we got another CAT scan in 3 to 6 months. And had that CAT scan changed, it could also get into the lymph nodes and make this a higher stage lung cancer. But with the new technology, we're going after things that are smaller than 1 centimeter sometimes.
Using the new Ion robotic system, Dr. Kapadia was able to navigate small areas that were almost out of reach, inserting a thin camera and cutting tools through the mouth, guided by a CAT scan. He was able to change the course of Tony's life. Lung cancer remains the #1 cause of cancer deaths. The biggest reason, it's usually picked up in late stages. So the Ion is a game changer. Dr. Kapadia took a sample of Tony's lesion, which confirmed stage 1 lung cancer. In a follow-up surgery, doctors removed the lobe of her left lower lung, ridding her of all traces.
It hadn't spread to the 10 or 12 lymph nodes that they biopsied. They were all clear. It's like, I'm done. All I have to do is have the every couple months protocol and then the 6-month x-rays. And as far as they're concerned, there's no need to worry about cancer.
It could have been a far different story had Tony waited. It's the kind of outcome that never gets old.
Getting a biopsy diagnosis at an earlier stage, which is stage 1, and allowing us to resect that patient, and they're now cancer-free.
Putting more lung cancer patients in the survivor column. Amy Osher, Wink News.
Amy, thanks. The Ion biopsy is done without cutting as an outpatient procedure, and doctors can screen more cases because there's less risk than doing a surgical biopsy. Lee Health did 172 last year.